Health pioneers present, don't shave too close. 6 Folliculitis natural treatments. What is folliculitis? Folliculitis is an extremely itchy rash that affects the hair follicles, causing a pimple-like rash, leaving skin painful and tender. The first signs may be clusters of small red bumps or white head pimples filled with pus. If the infection progresses, the pus-filled bumps will break open and crust over. This common skin condition can be caused by certain bacteria, viruses, fungi, parasites, yeast, ingrown hairs, and certain medications. It can also be caused when moisture is trapped against the skin due to tight clothing, tight hair braids, or by wearing rubber gloves or boots for extended periods. Folliculitis is not life-threatening, however when it occurs in visible areas, this benign skin disorder can be embarrassing and lead to scarring and skin damage. Signs and symptoms. The most common symptoms of folliculitis are the appearance of clusters of red bumps or white pus-filled bumps that resemble pimples. Intense itching and soreness is common. Superficial folliculitis, bacterial folliculitis. Very common. It's marked by itchy, white pus-filled bumps often caused by the S. aureus bacteria. The staph bacteria live on the skin all of the time, but generally only cause a problem when entering the body through a cut, scrape, or a wound. Hottub folliculitis. Generally, this type appears as a rash of round red bumps that are extremely itchy. They typically occur 24 to 48 hours after exposure to the Pseudomonas bacteria, which is often found in hot tubs and heated pools that are not properly chlorinated and pH balanced. Razor bumps, burn, or pseudofolliculitis barbae. Caused by ingrown hairs, most often on the face and lower legs. It is most common in men with curly hair who shave too close to the skin. It can also affect the lower legs and bikini line. This type may leave dark, raised scars. Pityrosporum folliculitis. Caused by a yeast infection, this type of folliculitis produces chronic, red pus-filled bumps on the back, chest, neck, shoulders, upper arm, and sometimes the face. Deep folliculitis, Psychosis barbae. Typically affects younger men and adolescents who have just begun to shave. Gram-negative folliculitis. Individuals receiving long-term antibiotic therapy for acne are the most common group affected by this type. Boils and carbuncles. Generally, it appears quite suddenly as clusters of boils or painful pinkish red bumps as a result of a staph bacterial infection deep in the follicle. Eosinophilic folliculitis. This type is associated with individuals who have HIV/AIDS and is a recurring problem. It causes intense itching and widespread patches of pimples near the face and on the upper body. Causes and risk factors. Recognized risk factors include 6. HIV, AIDS, diabetes, chronic leukemia, hepatitis, certain types of cancer, acne, dermatitis, seborrheic dermatitis, long-term antibiotic therapy for acne, immune-suppressing drugs, chemotherapy treatments. Being a male with curly hair who shaves, soaking in a hot tub or swimming in a heated pool that is not properly chlorinated, wearing clothing that traps heat and sweat against the body. Recognized causes of folliculitis include 7. Bacterial infection, S. aureus bacteria and Pseudomonas bacteria cause painful, weeping boils. These types of bacteria are common on the skin and thrive in the heated waters of a hot tub or swimming pool that is not properly chlorinated. Yeast infection, Pityrosporum ovale and Candida albicans are the 2 types of yeast most commonly associated with folliculitis. For young adults, P. ovale affects the upper chest and back, while C. albicans can affect any skin fold as well as around the beard on males. Fungi, ringworm of the scalp, can cause folliculitis symptoms and result in scaly hair loss. Viral infection, certain common viruses including the herpes simplex virus and herpes zoster shingles virus can cause folliculitis. In infants and young children, the virus molluscum contagiosum can be the root cause of clusters of painful bumps in skin folds. Parasitic infection, this type of infection most often affects immunosuppressed adults and healthy seniors. Hair follicle mites can infect the scalp and face. In some cases, scabies can trigger folliculitis, resulting in painful, weeping sores that heal slowly. Ingrown hairs, often a result of improper shaving, electrolysis, plucking or waxing. Unless there is a presence of bacteria on the skin, it generally does not become infected. Contact reaction, certain topical preparations including paraffin-based ointments, moisturizers, certain chemicals and the overuse of topical steroids are associated with folliculitis. Medications, certain medications including corticosteroids, androgens, ACTH, lithium, isoniazid, phenytoin, B-complex vitamins, protein kinase inhibitors, and certain medications for metastatic melanoma can cause folliculitis. Underlying skin diseases, acne, acne-like disorders, lichen planus and discoid lupus erythematosus can cause folliculitis. 6 natural home remedies for folliculitis. 1. Apple cider vinegar pack. According to a study by researchers from the University of Birmingham in the United Kingdom, acetic acid, or vinegar, is shown to inhibit the growth of certain strains of bacteria. 1. Apple cider vinegar pack. According to a study by researchers from the University of Birmingham in the United Kingdom, acetic acid, or vinegar, is shown to inhibit the growth of certain strains of bacteria. They studied the responses of many bacteria to vinegar and found that Pseudomonas aeruginosa, Acinetobacter baumannii, Staphylococcus aureus, Enterococcus faecalis, Escherichia coli, Klebsiella pneumoniae, and Enterobacter were the most positively affected by vinegar at a concentration of 0.16% to 0.3%. 2. Tea tree oil. Known for its ability to fight bacteria and fungi, tea tree oil can be easily added to your favorite shampoo and body wash. This is particularly helpful for recurrent folliculitis as it is shown to be effective against bacteria that occur on the skin, including staph and most gram-negative bacteria. Plus it demonstrates great antifungal properties. 3. Turmeric. Known for its anti-inflammatory, antimicrobial and antioxidant properties, there is growing evidence that shows turmeric is effective for treating a variety of dermatologic diseases according to a systematic review published in the journal Phytotherapy Research. Researchers looked at results of 18 studies and found that 10 studies showed significant improvement in skin disease severity with turmeric curcumin treatment. 4. Witch hazel. Used for generations for skin ailments, witch hazel is safe and effective for a myriad of hair and skin conditions, including folliculitis. Witch hazel fights bacteria while soothing irritation, including itching and inflammation, according to a study published in the International Journal of Trichology. 13. Apply witch hazel with a sterile cotton pad on and around the bumps and pimples. For the scalp, mix several drops of witch hazel into your shampoo and your conditioner and then wash, condition and style normally. 5. Grapefruit seed oil and geranium oil. According to a study published in the journal Burns, grapefruit seed extract and geranium oil, when used together, fight staph and MRSA. The study conducted by researchers from the Department of Biological Sciences at the Manchester Metropolitan University tested a variety of essential oils, including patchouli, tea tree, geranium, lavender, and grapefruit seed oil, to determine their antibacterial activity against the 3 different strains of staph. 6. Neem oil. Because of its powerful antiseptic and antifungal properties, neem oil may rid the skin of bacteria and certain fungal infections, including Candida albicans, while reducing redness and inflammation. It may even help to prevent scars. In a study published in the Brazilian Journal of Microbiology, researchers praised the antifungal effect of neem at a 20% concentration. Thanks for watching. Please like and subscribe to this channel.